Now, here's the thing about asthma. It's not one size fits all. It's a complex condition with various forms. There are actually different types, each with its own set of triggers and symptoms. Understanding these can help in managing the condition better. Let's break it down, shall we? Knowing the type of asthma you have is crucial for effective treatment. First up, we've got allergic asthma, the most common type. It's often seasonal and can be quite bothersome. It's triggered by, you guessed it, allergies. Common allergens include pollen, dust mites, mold, and pet dander. Pollen, dust mites, mold, pet dander, you name it, allergic asthma hates it. These allergens can cause significant discomfort. Symptoms include wheezing, coughing, shortness of breath, and chest tightness. These can vary in intensity. Next, we have non-allergic asthma. This type can be more unpredictable. This type isn't triggered by allergies, but by other things like stress, exercise, cold air, or even strong smells. Managing these triggers is key. Symptoms are similar to allergic asthma, but the triggers are different. Recognizing these can help in avoiding flare-ups. And lastly, we have cough variant asthma. This type is often overlooked. This sneaky type mainly causes a dry, hacking cough, often at night or after exercise. It can be persistent and annoying. Wheezing and shortness of breath might not be as obvious, making it tricky to diagnose. Proper medical evaluation is essential. Occupational asthma, when work takes its toll. Now, let's talk about a specific type of asthma that's work-related, occupational asthma. This one's a bit of a bummer because it's triggered by stuff you're exposed to at work. Imagine that. Your job is literally making it hard to breathe. Think about it. If you work in a factory with chemicals, a bakery with flour dust, or even a hair salon with strong hairspray fumes, you could be at risk. These substances can irritate the airways and trigger asthma symptoms. The good news is that occupational asthma is preventable. Wearing protective gear like masks and gloves can help reduce exposure to triggers. And if you're experiencing symptoms, talk to your doctor right away. They can help you figure out if it's work-related and what you can do about it. Exercise-induced asthma, a breathless workout. All right, let's talk about exercise-induced asthma. This one's a bit of a head-scratcher because exercise is supposed to be good for you, right? Well, for some people with asthma, it can trigger symptoms like coughing, wheezing, and shortness of breath. It's like this. When you exercise, you breathe faster and deeper, and that can irritate the airways, especially if they're already sensitive. Cold, dry air can also trigger exercise-induced asthma, which is why it's more common in the winter or when working out outdoors. But don't let that stop you from breaking a sweat. Exercise is still important for everyone, including people with asthma. The key is to find activities that work for you and to use your rescue inhaler before exercising if needed. Talk to your doctor about creating a safe and effective workout plan.
Childhood asthma, a parent's guide. Now let's talk about childhood asthma. This one's close to my heart because it affects so many kids. In fact, it's one of the most common chronic diseases in children. Imagine being a kid and struggling to breathe. It's scary for them and heartbreaking for parents to see. Childhood asthma is often triggered by the same things as adult asthma: allergies, respiratory infections, irritants like smoke and pollution. The symptoms are similar too: wheezing, coughing, shortness of breath, and chest tightness. The good news is that with proper management, most kids with asthma can live normal, active lives. That means taking medication as prescribed, avoiding triggers, and working with your child's doctor to create an asthma action plan.